madam.
Good afternoon to
My name
you.
is Timothy Subuga from Popular Health Services. This is Edward Sevaida. So, a lot can be said about autism in Uganda, but we shall first begin with the nitty-gritties. Who is the lady standing before us? And when was Dorna Center formed? And what does Dorna Center do?
Thank you so much. I'm Mr. Rothinambi, the founder of Dorna Center Home for Autism. Dorna Center started in 2014. We started with 5 children. Currently, we have 30 children, and of course, more are enrolling in. I would actually say autism is a lifelong developmental disorder that affects children in different ways, not only children, but even adults. But it affects them in their communication, in their behaviors, and the way they relate with the world. That's what I can say about autism. Then, how did Dorna Center start? I am a teacher by profession, then also a special needs teacher. So when you find an ordinary setting, you would see that the regular children have the ordinary teachers to support them. But when it comes to children with learning challenges, they are normally left behind. That's where I said I should go because there was a very big gap.
So, looking from the time whereby the institution started in 2014 to currently 2025, what would you say are the biggest milestones the institution has had?
Okay, so I think I can say the first milestone I can say, Dorna Center starts with 5 children. Right now we have 30 children. The awareness that as Dorna Center we've really tried to put out there shows that people are responding to what we are calling out for. For us, that is a very big milestone. When it comes to the stigma, you're seeing the perception is now becoming positive because people are coming in to accept who their children are.
So many would think that autism is a disease, but you earlier said that it's a neurological disorder. So what would be the right definition of autism?
I would still say that autism is not a disease because the way you've tried to see the children, they look ordinarily normal. They don't look sick. Of course, they can also suffer from malaria. We have those who are suffering or struggling with epilepsy. Yes, that could be the disease. But autism on its own is not a disease, but we'll still say it is a neurological developmental disorder that affects them in their social communication, in their social life, and with their behavior. You saw someone who you were saying hi and happened to look the other side. But when it comes to autism, they're like, I've seen you. Just give me some time. I'll respond back to you.
So, you earlier talked about stigma and misconceptions that autistic people face in the society. So, talk about what the Dorna Center is doing to combat autism, this stigma and misconception that autistic people face.
Okay, so I can say that the stigma, as Dorna Center, we've really worked so hard when we are raising awareness, because when it comes to raising awareness, we've celebrated the World Autism Day so many occasions, and we have seen big numbers. For us, a mere seeing the big numbers come for an event is a sign that the stigma is going down. It's a sign that people are hearing about autism, and it's not anymore the thinking like society had that this is witchcraft, because that is the bad and the other worst part of the message people normally relate our children to. So when they come closer to the children, they see them ordinarily normal. You've seen and you've witnessed the hug. Someone gives you that round hug. But is there any way you're going to be a victim of autism? It is not contagious. It's nowhere connected to the negative perception people have. So for us as the center, we are like, I think now the world is accepting, and the barrier and the attitude around stigma is being broken down.
So, though you've talked about the biggest developments that the Dorna Center has had in terms of wins, from 5 to 30, preparing also to talk about issues like stigma and misconception people have about autism. What are the biggest challenges that the Donor Center faces in this fight of helping autistic people?
Okay. So when it comes to the challenges are really very many, but I can start with the family challenges, where we have parents who are actually fighting amongst themselves and then not willing to support the children because the child has autism. We have so many families that have broken down, people are parting away because the child has a problem. And of course, as an organization, when we actually get many of such cases, of course it hurts to see it is now the mother struggling with this child. And then the mother will tell you the father has left me with this child. But when it comes to the financials, you're seeing this mother really struggle as an individual. So that is one of the biggest challenges I can say. And of course, when it comes to having these children in school, you find that those children actually who live with special needs are normally put behind. So as an organization, we are trying to show that don't leave them behind. They have the rights like any other child to be at school. So we normally have our social medias trying to show the beauty about our school. So people feel that, oh yes, let my child go to school because it's another beautiful environment. They should also access like any other child.
So I believe this institution is focused on skill development. In that you are teaching these autistic people how to learn skills, which I believe help to develop their motor functions. So what skills are you teaching them, and how are they helping them become better people in society?
So at Dorna Center, we have a lot of vocational training skills for our children. The categories could be tailoring, we have briquette making, we have chicken keeping, we have urban farming, amidst also art and craft. So in the midst of this, we are trying to discover what can our children do. Where will they be one day in the future? When we talk about chicken keeping, we've had an improved kind of a cage that any other child living with special needs can actually work on a system of that kind, because it is not so local that if maybe we have those who have the phobia to animals, they can go in and feed the chicken. So we are trying to see what can they be one day in their community. So for us at Dorna Center, these are like demonstration activities.
So have there been, you've talked about how you're actually fighting this misconception about autism with parents, telling them an autistic child, autism is not a disease that is spreadable, contagious, but it's something that is more of a neurological disorder. So talk about the support that you're giving families who have autistic children, maybe mental or moral support, maybe guidance and counseling. But in that regard, what are you doing so that these families are more acceptant to their autistic kids?
Okay, so what I can say about that as Dorna Center, or me personally, the founder, when we get families that are like really stranded with the children, because one of our activities at Dorna is counseling and guidance. So we do more of that talking and support, spiritual support, moral support, where sometimes people are giving up on their children, says, please do not, it's not yet the time, just still hang on. Even now when we come to some families where we are seeing the father is leaving this mother with a child, we are trying to say where we can come in, we are trying to encourage them that this child is innocent like any other child. They didn't call to be the way they are, because we had one who was locking up a child in a cage. But right now, you see, the father is now more positive than even the mother. To us, that is a positive move that, let's keep on raising awareness. Let's keep on talking. Let's keep on showing them love. Of course, we've understood them, and that's the same thing. We're also encouraging parents, love accept your child and support them, then they will be of value. So one of this child I'm talking about can now wash dishes very well at home, and the father is like, oh my God, I didn't know my son could now be this a resourceful child.
So we are living in a time whereby donors are cutting funding for health services and also cutting funding for organizations like this. What kind of action would you give to potential donors and the wider community on how they can support the Donor Center for Autism? Donor Center Home for Autism.
Wow, I think that is really something. If the opportunity arises, we really call for support. When we call for support, what do we mean? Because the numbers about autism are on the increase. I can just give an estimate of, I think, 700,000 are children estimated to have autism in Uganda. And when you look at that number, it is then really too big that when I say the parents have their negative attitude around supporting their children, then this calls for the demand that if there are outside sponsors, if there are outside donors who can come and stand with us, not only me as an organization, but there are many other organizations that are really struggling. Their children are innocent and they need support. So if they are cutting off support, for us we are saying please do not. And where they can still come in, we call for them to come in and still support, because just feeding our children here is a cost. Raising rent is a cost. The manpower is a cost. So we would need like more children, but then just look at our space. And the children are not able to pay what we call our maintenance fee. So that is a gap that we call for sponsors to come in and stand with us. Everyone out there, would you want to know about autism? Join us at the Family Health Expo and Symposium. That will be at Uma Showgrounds, Lugogo, from the 1st to the 3rd of August 2025. Come and learn more about autism. Don't miss.